Okay, hey, my name is Bill Warner, and I appreciate you taking some time out of your day to talk to us today. I run a Medicare agency in Glendora, California. We're downtown Glendora. My dad is Kirk Warner. I've been working with him for about 17, 18 years now. He's going on or the business has been around for 40 years. But we have been prioritizing helping people with their Medicare enrollment. And I know, Medicare, it's something you're gonna have to think about, right? You're turning 65 soon. So, but it's a good thing to think about. You should be saving money. Most people are going to be saving money. Most people are getting better coverage. And it's a good thing. You're finally getting access to your Medicare benefits. So if you didn't know that, hopefully you know that. Hopefully that'll help us do the hard work to get over this hurdle of something we have to do before we turn 65, or at least make a decision on what we want to do. So this is something you're gonna have to get done. So let's try to do a little bit of work here. And really what I encourage everybody to do is to grab a piece of paper and a pencil, because it's simple if we write it down. If we get all these numbers in our head, that's what makes it complex. Okay, so let's just do some groundwork first for you to make sure we're doing this as simple as possible. Hopefully, we won't have to spend too much time on this, but let's talk about the government part of Medicare real quick. So when you're going on to Medicare, first you need to know when's the soonest it can start. Well, the soonest it can start is the first day of your birthday month. If you're born on July 15th and you're turning 65 in that month, it's going to start July 1st. Okay. There's a caveat. If you're born on the 1st, they'll actually give you it a month early. So if you're born on July 1st, you're going to actually be able to get it as soon as June 1st. Okay. Second thing so please write that down. When's the soonest it can start for me? Okay. And then with that information, let's write down what's my initial enrollment period. So there's a 7 month window. So let's say you're born on July 15th, you have April, May, June to apply for a July 1st effective date. Okay. If you apply during the month of July, your Medicare will start August 1st. You have 3 months after your birthday month to apply as well. If you apply at that time, it'll start the first of the following month after you apply. Okay. So that's the enrollment window. So how do I enroll? Well, the easiest way to enroll is on ssa.gov. Okay, so you just go to the Social Security website, and right on the front there, it's going to say, "Hey, apply for Medicare," and then it's going to walk you through the steps. It's about a 15-minute process. Okay, and if you don't like doing that, you can make an appointment at your local Social Security office, or you can call Social Security, the main number over the phone. Okay, and that will get you on. So those are the three ways you can apply: ssa.gov, go into local Social Security office, or call the National Social Security number. Okay. When's your window? Let's say if you know you're born July 15th, your coverage is going to start July 1st, then your window of time is April through June for that July 1st effective date. Okay. And I would recommend applying, 6 weeks at least before. That way, it takes them about 2 to 4 weeks to get you your Medicare card. They're generally pretty quick, actually. Okay, so now we know our enrollment window. Okay. Second, let's talk about, so there's Medicare A and there's Medicare Part B. Okay. So for most people who've worked in the United States for at least 10 years, Medicare Part A is going to be $0. Medicare Part A covers your hospitalization. Medicare is a wonderful insurance plan, the best insurance plan. All the doctors, all the hospitals, I should say, take Medicare Part A, essentially. City of Hope, Cedar-Sinai, Hoag, Irvine, Loma Linda, around Glendora, the eminent hospitals, San Dimas, Arcadia Methodist, Huntington Hospital, they all take original Medicare Part A. Okay, and that's going to be $0. You're not going to pay any premium for that, unless you didn't pay into like your. I run into people sometimes that didn't pay any like any other payroll taxes. Sometimes and they end up having to pay for Medicare. But I mean, but Medicare Part A, but that's probably not your situation. And then there's Medicare Part B. Medicare Part B covers your outpatient services, okay? And basically, if any of those doctors want to work with any of those facilities, they're basically in network with Medicare. It's a huge network of doctors. It's most likely better, even if you're on the premium PPO plan through your thousand person employer. Medicare probably has a better network than that company does. Okay, so yeah, this is an unbelievably good network of doctors. And so Medicare Part B, what's the cost for the guy who's married, or the gal who's married and their income's under about 200,000, they're going to pay 202 a month, roughly $202 a month for their Medicare Part B insurance. Okay, if they're making more than that, there's some income related monthly adjustment amounts. So if you make more, and they're going to go off your income 2 years backwards. So if you were in 2024, you made 600,000. They're gonna ding you with an IRMA fee, and that's really easy to look up. Just go on Medicare.gov Part B IRMA, and it'll tell you. It has a wonderful chart. Okay, it's gonna say, oh, you're gonna pay $600 a month for Part B or something. Okay, and now there is a way to dispute that. If let's say your 2026 income is different than your 2024 income, you just Google Part B premium, uh, appeal form, and it'll pop up right at the top. It's a form. You're going to have to complete that, bring it into your local Social Security office with proof that your income's changed or lower, and you know what? They'll adjust your premium. They work with you. This is not is yeah, it's something you have to do, but um, this is a pretty big benefit right now. Right now, there's doctors or there's medicine that's extremely useful out there, and if we use it, our lives gonna be better. Okay, so now that so that's the Part B. So you're paying zero for Part A. You're gonna pay 202 for Part B in most situations. Okay, so now do I need to enroll in those? Okay, well, do you need to enroll in Part B? Well, if you are still insured through your employer, if you're working past age 65 and your employer employs more than 20 people, and your premium's low, like under $400 a month for you, and then under $400 a month for your spouse, then no, you don't need to enroll in Part B, and you won't be penalized. The government doesn't want to penalize you for letting your employer pay for your health insurance. So if what they don't want to happen is they don't want you to say, oh, I'm eligible for Part B now, but I'm not going to take it because I don't want to pay the $200 a month, even though it's worth way more than that. But you didn't want to pay the $200 a month, so they don't want you to say, oh, I'm just going to wait till I get sick and then pay the $200 a month. That's why there's a penalty. But if you have coverage through your employer, and plus employer's probably paying $1,500 a month, the government says, oh, hey, we'll let you take that life. Sure, thank you. Go. We're not going to penalize you for that. Go ahead and stay on that plan. But when you retire, we're going to give you a window of time to jump on Medicare, and you won't be penalized for enrolling late. I don't know if I rambled there at all, but that's what that is, okay? So if you're getting a good deal through your employer, you might want to stay on your employer plan. Especially if, let's say, your wife's or your husband's 5 years younger than you, and they want to stay on the employer plan, they're giving you a large contribution towards them, you might want to stay on the employer plan, because if you go off that employer plan, we'd also have to get a plan for your spouse. That might not be cost effective, but that's the long story short. You don't have to. If you're insured through an employer with more than 20 employees, you don't have to enroll in Medicare A and B. Or no, you don't have to enroll in A and B. You should enroll in A because it's free, but you have to go through the hassle of actually enrolling in it. And then so that's that. And then okay, so now let's say If you work for an employer with under 20 employees, well, that's different. You do need to enroll in A and B, period. You can stay on the employer plan, great. Or you can get off it and buy a supplement plan. It would be way more cost effective if you did that. But if you work for an employer or you're self-employed and when you turn, you need to get on Medicare Part. You need to go on A and B. Okay, so everybody should get A because it's free, but you're not going to be penalized if you have an employer plan over 20. But if you have an employer plan under 20 employees, you need to enroll in A and B, or else, you're going to miss your window and you will be penalized if you enroll later down the road. So basically, there's if if it's less than 20 employees, Medicare is considered your primary insurance. If it's over 20 employees, Medicare is going to be the secondary. So that that under 20 health insurance plan is considering that Medicare is going to be there to pay 80% of your doctor bills and a big portion of your hospital bills. So if you don't enroll in that and you're just on the employer plan and you're over 65 and they have under 20 employees, you could be on the hook for 80% of all your doctor bills. And then the hospital, you could be on the hook for, everything over 1,700 bucks. So you really should enroll in A and B there. Okay, so that is talking too much about that. And so that's kind of, so now we know basically if you have an individual health insurance plan, if you're self-employed or if you're insured, or if you are insured through an employer that has less than 20 employees, you need to enroll in A and B during your initial enrollment period. Okay. Okay, so now we know if we want A and B. Okay, and it's so now you have we're now let's talk about what A and B does. Well, basically, A is pretty simple. It covers all your hospital bills per occurrence, except for the first $1,700. So you pay the first 1,700, they pay the rest each time you're hospitalized. Okay, then if you go, let's say you're hospitalized, you can't go home, you got to go to skilled nursing care. First 20 days, they're going to pay for your skilled nursing care. Then after that, you got 80 days where you'll have to pay $200 a day up to 100 days, and then you don't have any coverage. Okay, so that's part A. That's your hospital coverage. So that's pretty good. That's pretty good compared to what you probably have right now. It's amazing coverage and it gets you to better hospitals or the best hospitals. Okay. So, and then Medicare Part B. Okay, how's that going to work? Well, that's going to have an annual deductible of 200. Uh, yes. Okay, so Part B has a $282 annual deductible. Okay, and so basically that means when you go to the doctor the first time through the year, you're going to pay full price. When you get a lab, Part B covers doctor visits, lab works, outpatient surgery, chemotherapy, infusions, durable medical equipment. Basically, very unbelievably very comprehensive coverage. Okay, so um, you go to a doctor for it, they basically cover it. Okay, so um, you pay the first 282, 100% of the first 282 of the cost for those services. Then after that, Medicare comes in and pays 80%. You pay 20%. So that's a good thing to write down. So for like Part A, per occurrence deductible, $1,700. Part B, annual deductible, $282. After deductible, I'm going to pay 20%. Medicare is going to pay 80%. The gotcha is Medicare, there's no cap, right? So Medicare will only pay 80% of no matter what the bill is. If it's $100,000, unlikely, but let's say you have a $100,000 bill, they're going to pay 80%, you're going to pay 20%. Okay, so we're at, yeah. So that's 20 grand. Okay. So So that's how Medicare Part B works. It's extremely simple. Basically, your doctor accepts it, which is wonderful, you know. So now, what's the problem? Well, so what doesn't Medicare do for you, right? Well, the one thing Medicare. Well, let's talk about what Medicare does do for you. It's the best fast pass to doctors available to human beings. It's taking care of the a hardworking, wonderful group of people in America that have made it to age 65. They say, "Hey, we're going to give you something. We're going to give you the ticket to make you take the short line to the doctor." Basically, there's not going to be an authorization process. If you have this, the doctor's going to be able to get you in, and they'll know how to collect money from Medicare. Okay, so that's great. Okay, and then um, but what doesn't it do? Well, it doesn't give you a max out of pocket. So you're on the hook for 20% of an unlimited amount. So we can write that down. There's no max out of pocket. I am on the hook for 20% of an unlimited amount. Second thing is there's no prescription drug coverage for there are some drugs covered under Part B, but the majority are not. They're you have to buy a separate plan for that. Okay, so now the next hurdle comes, right? So let's say, hey, so I understand Medicare. I know I'm paying $202 a month, or maybe I'm paying more if I have to pay IRMA as well. But now where does insurance agent like you come in? Like, how do you get involved? Well, I could come in and offer you what's called a Medicare supplement plan. So there's two basic supplement plans you're going to want to look into. So and they're both start with they're both the plan G. Yeah, generally this is sold 100% of the time. It's got a G in it, it seems like. Okay, so it's so there's let's say when you turn 65, the going rate in my area for the plan G is basically like $200 a month. So you're already paying 202 for Medicare. You could buy the plan G, the regular plan G for about $200 a month. And then that's going up, 10% a year. So inflation hits health insurance very hard. So, you could expect to pay 220 next year, 240, 300 pretty soon, right? So this is kind of the people that go this route are people that are used to having really fast access to doctors. Like they're the type of people when they go to Disneyland, they don't go there that often, but when they go, they want to take the short line and they want to have access to all the rides. And so you got to pay extra for that Disneyland ticket. There's other folks that that go in and they can get access to one park and they're going to take the long line and that's a different route. We could talk about that later. But right now we're talking about the fastest pass to the doctor available and it's going to cost you some money. Okay. So you stay on Medicare and you get the Plan G. What does the Plan G do for you? It doesn't get you more access, but it allows you to stay on Medicare. It's not have to worry about the hospital deductible. It's going to pay the $1,700 hospital deductible. If you can write that down, the Plan G makes it so when I go to the hospital, it'll pay the Part A deductible, the $1,700 Part A deductible, and then Medicare picks up the rest. So essentially, my hospital visit will be $0, and I can go to City of Hope, Loma Linda, Cedar Sinai, Hoag. If I have a hip surgery, I can get multiple opinions. I've seems like everybody in my family that's had orthopedic surgery is doing it at Hoag. I guess it's I guess it's amazing. So, and they have Medicare with the Medicare supplement. They don't, and then so how does it supplement? So, Medicare is the primary. The Plan G is a supplement. It's a secondary. It's like a little trailer fish following the shark. The shark is Medicare. It chooses what providers you can go to, or it eats the bill, and then the supplement just picks up the scraps. So let's say you have then you go to a doctor, right? And they do an outpatient surgery. You have a hip surgery. Say it's 30 grand. I don't know how much those cost, but The Plan G will not pay the Part B deductible. That $282 Part B deductible, you are still going to have to pay that. But the Plan G is going to come in and pick up the 20% scraps that are left over after Medicare pays 80% of that. So that 30,000, that whatever $1,000 hip surgery, if you haven't had any medical bills that year, it is going to cost you $282. Then after that, you're not going to pay anything, and then you're basically have met your medical deductible for the year. Okay, so uh, that's that's how the Plan G works. It's that simple, and it really doesn't matter what carrier you go with. You usually want to shop that on price, and um, so you could go to United American, United Healthcare, Anthem Blue Cross, Blue Shield, whoever you want, really. Just the price has got to be good and they've got to be reasonable to work with. So, and that's what we do. We get people into those plans, okay? And then so the second plan is maybe, it's not very common, but it's not a bad deal. It's the high deductible Plan G. So how that plan works, that one's like $50 a month, right? That's why people go on it because it's so cheap and they still get their access to doctors. A lot of times, people that have been used to being on PPO plans are used to having higher max out of pocket. So essentially, how this works is on the high deductible Plan G has a deductible of $2,850. So basically, you're on Medicare alone until you spend out of your pocket 2,850, and then it comes in and picks up 100% of the cost. So you do have bills that come in. There is some administrative pain. You do have to kind of, do I owe this? Do I not owe that? But it's a huge savings, right? You're going to save 1,800 a year at least in premium. If you're a little bit older, you're going to save, let's say you're 75, you're probably saving 2,500, 3 grand a year in premium. Now, if you get sick, right, you're gonna, let's say if you're hospitalized on that plan, you have to meet your Part A deductible, which is $1,700. Okay, so it costs 1,700 when you go to the hospital. That eats up your premium savings. Or if you have a $30,000 surgery, well, you're going to pay 20% of that, so that's going to be 6 grand. But you're going to pay that up to the 2,800, 2,850. Then the high deductible Plan G comes in and pays 100% of your cost. So, um, you know, it's it's it is just, you can just, it's gambling, or it's not gambling. You're just taking calculated risks. So you can decide where you want to lay your chips down. Um, so that's that. So now we know we've got our hospital and doctors covered. Then we got to go and get a prescription drug plan. So let's talk about costs. So we know for Medicare we're paying at least 202, and then the Plan G is generally $200, or the high deductible Plan G is $50. The max out of pocket on the Plan G is 282. The max out of pocket on the Plan G high deductible is going to be 2850. Okay? If you probably write that down somewhere, that'd probably help you come to a conclusion about your Medicare thing and move on with your life. Second thing, you got to decide. No, not the second thing. Part D, we got to find a prescription drug plan. Okay, there's only 12 of these out there, and one of them costs $0 in our area. One costs $5.70. Now there is some income related charges to this. If you Google Part D IRMA, it's going to come up with a chart with how much extra you're going to pay for your Part D plan based upon your income. Okay. And I think some people are paying $100 on top of their Part B premium. So even if your premium $0, if you made $1 million in 2024, you're going to have to pay zero for the Part B plus $100 a month for the Part D plan, and then $100 a month for the Part D plan based upon your income. And so how do those plans work? Well, they're pretty simple. They have a max out of pocket. That's the most critical thing for you to understand. The most critical thing for you to understand, and you should write it down, all Part D plans have a max out of pocket of $2,100. After $2,100, the Part D plan pays all my cost if my prescriptions are on that plan's formulary. Formulary is a list of drugs covered. So, like for example, we've been helping. There's a bunch of people go on to Medicare supplement plans because there was a very notable Medicare Advantage plan that used to allow you to go to City of Hope. Now, City of Hope doesn't really take any Medicare Advantage plans that individuals can go on. This was actually a group plan, and they had cut their contract with City of Hope. This person was in the middle of treatment. They needed to jump off the group plan and get onto a Medicare supplement. So we helped them do that, and it turned out their drugs like 40 grand a month or something like that. And they got on this little $5 prescription drug plan, and they will have to pay like the first time they get it, they're gonna pay like $2,100. But then after that, they're not gonna pay anything for it. So that's good. That's really good. So, okay. So now for folks in less extreme situations, let's understand how the plan works and how the plans generally work. They usually have a deductible of around $615. That's the standard deductible. So the Part D plans have a deductible of 615 for brand name drugs. They have a zero deductible for generic drugs most of the time. But if for brand name, you're going to pay 100% of the cost up to 615. Then after that, there's a co-insurance process or a copay until you meet the max out of pocket of 2,100. Okay. These are very easy to shop. You know, when you talk to a broker, they type in your medication and then it comes up the plan. It comes up with it'll show they have programs that'll say, oh, out of these 12 plans, which one covers my list of meds the best? Uh, it's gotten way better over the years, and so, most of our clients are on a plan that costs $5 a month, and it works great. They're at, and we help a lot of really sick people. So that's that, and then so yeah, so let's say if you did you have your Medicare card, you have your Plan G card, and you have your Part D card. So your Medicare card's going to be 202, your Plan G is going to be 200, your drug plan is going to be $5 or $6. Excuse me. So what's that math? 408, and that's for the best coverage in the world, basically. So that's what it would cost there. So that's the premium option to Medicare. There is another option. Let's say, hey, that's too much. Why? I've never had a PPO plan. It's not important to me. I don't need access to everywhere. I don't mind getting a referral. I've got a great relationship with my primary care doctor. And on that Medicare bill, you didn't even bring up dental, vision, or whatever else you want. Like people want hearing aid coverage now. People want all sorts of, they want their utility bills paid through their health insurance, which is great if you can get it for sure. But they're taking money from the doctors to pay for those things. I think that's an important part. Like, so the insurance is usually a vehicle to get you to the doctor. If you try to make it something else, it will diminish its ability to do what it was supposed to do, right? So on the Medicare supplement, if you do want dental, you're gonna have to buy it. You can buy a Delta dental plan, or you could get one with the carrier that you're with. It's usually like 50 to 70 bucks a month. The max it's gonna pay is 1,500 to 2 grand a year. Usually people aren't carrying dental unless they had it through their employer, but we can help you enroll in it if sometimes the best dental insurance is just putting 100 bucks a month in your own bank account, and just the dentist isn't going to take your assets. Insurance is generally an asset protection thing. Insurance is kind of this, dental insurance is like a cash flow insurance, right? So if you know if you need money coming in, and you don't have enough saved up, then yeah, maybe, yeah, we need to do some dental insurance. But most of my clients don't have dental insurance. Um, and then vision, kind of the same thing, 15 bucks or so. But if you do this Medicare Advantage plan, it includes all that, right? So what you could do is you can say, hey, look, this is too much. 406 without dental and vision. If I added the dental and vision, we'd be up to like close to 500. No, I don't want to do that. So I want to go to what's called a Medicare Advantage plan. So This is, hey, I'm gonna cancel out my Medicare. Like we got this entitlement when we turned 65. It's worth a lot of money. Okay, and so we can say, this is great, but I'm really happy with my primary care doctor, and I'm used to an HMO system. So I'm gonna give that to an insurance company, basically, which is great. And then the insurance company is going to take your Medicare money. You're gonna still have to pay your Part B premium, so it's still going to cost you 202 a month. But you can trade your Medicare into this insurance company. The money set aside to pay for your Medicare benefit will the money set aside to pay for that your Medicare will go to that insurance company, and then you will go ahead and um, now the insurance company will be in charge of your health care. They'll offer you benefits, usually very low copays. You don't have to pay much for anything, but they're going to give you a list of doctors and hospitals you have access to. They're going to usually give you a primary care doctor, and that primary care doctor is going to be referring you to specialists. Okay. And so that is a very cost effective way. That route usually only costs you $202 a month, unless you have IRMA. It costs you what you're paying for your Part B premium plus whatever IRMA you have. So that's the cost effective way to go. It's a little bit more complicated. There's a lot more plans. Then there's a lot of ancillary benefits. A lot of times they include dental, vision, hearing, pay your utility bills. They give you over-the-counter stuff. They all things like that. So those are called Medicare Advantage plans, which really they should be called Medicare replacement plans. So that's a huge business. It's a way for the doctors and the insurance companies to get your Medicare money basically before they see you, and then they get paid kind of, you get the insurance company gets the money, and then they send it to a group of doctors to be available for you. On the Medicare side, when you keep Medicare and Medicare supplement, nobody's really been paid at all unless they've done work for you, right? There's nobody that's getting paid to be available for you. They're they're only getting paid after they do the job for you. So it's a little bit different program. It's so definitely there's cost is a real deal. I know money's not an unlimited thing. So I would encourage you, if money's not an unlimited thing, for you to think about that high deductible plan, G. That's a simple, affordable way. If you did that, it would be two 202 plus $50 plus five. So we're still at 350, but I mean, and I guess not, but I mean, I guess there's money's not unlimited. Uh, but for what money can buy, what medicine can do for people, and what the contrast in medicine is between good medicine and bad medicine, I see value if you can afford it. Um, uh, so that's it. I thank you for hanging in there with me. If you want to have a one-on-one discussion, I have a team of agents that would love to, that are eager to sit down and explain this stuff to you, help you, walk you through how to enroll in A and B, walk you through customizing your plan, whether you want to do a Medicare supplement or you want to do a Medicare Advantage. So I really appreciate your time, and thanks again.